this was kind of the future of private practice healthcare, to have people doing a lot of the administrative work remotely.
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab.U Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab.U Practice Solutions. And if you have not checked out the book, Better Outcomes, A Guide to Humanizing Healthcare, what are you waiting for? The book is now available on Amazon, Barnes & Nobles, wherever you buy books online these days. It's available in Kindle and print, and the goal is to hopefully get a audio version, an Audible or audio version out. Given just the timeline and what I've got with clients and work and stuff, it'll probably end up being January, but my personal goal is to try to get it done before the holidays. We'll see what happens though. Alrighty, this week we are diving back into the world of business, but it's where business and technology meet for improved efficiency and sometimes even streamlined care. So you have probably heard or even used maybe even virtual assistants and the like at various businesses. I know we run basically all of the consulting work that I do here at Rehab.U is basically managed between myself and then a virtual assistant that does all the coordinating in the background, the schedules. If you've been on the podcast or been scheduled for an interview, you've had interaction there. And it's great for just efficiently doing the work that we need to do on a remote basis. There's no reason to have office or to eat up office space with some of the stuff. It's all knowledge work and it's all communication, which can be done from anywhere. And some people in healthcare, specifically private practice healthcare and the like, really have not jumped on board with this remote work or virtual assistant work because they might not see the value of it, or two, it just seems like too much of a headache. Big hospital systems, that's what they're doing, right? You have call centers that manage cancellations and rescheduling and appointment reminders and billing and all that kind of stuff. And sometimes those offices are located in the hospital system. Sometimes they're offshore, right? Well, for a long time, it's been maybe cost prohibitive to tap into that as a US-based private, especially private therapy practice, something like that, until recently. So Dr. Kupferman, who is my guest this week, runs Medva or MedVA, and they do virtual medical assistants or medical virtual assistants for private practices across the country, and they have their folks based out of the Philippines. Now, one thing about Medva, which I like, and we talk about it on the show, is that oftentimes, like with call centers and with outsourced or offshored, any kind of work like that, and customer-facing work, it ends up detracting from the overall customer experience, right? Because this person calls in and it's a call center and they're getting, somebody with call one, and they might get somebody else when they call in the second or third time. So there's no consistency and it lacks a lot of that personal interaction. So the way Medva gets around this is that they don't do a call center. They don't do like a pool of VAs that, are serving 15 different doctors or practices or therapy practices at one time. They get one dedicated virtual assistant that gets assigned to your practice. And that way, if you're doing it right and you're training and onboarding correctly, this virtual assistant essentially becomes just a remote member of the team. They know the patients, they know your team members, they know your processes and your workflows. They hopefully will eventually know the patient's names and all of that kind of stuff. So that when they're doing work for you, it's not so much that you're outsourcing this into a call center or to a group that's going to make it a very impersonal experience, but you're just taking a member of your team and you're moving them remotely. I kind of like the idea of this for two reasons. One, because there are some things that just don't need to be done in the office and can be done whenever, right? Benefits verification and eligibility verification doesn't need to happen in the office. It can happen remotely. And we live in the world of technology and remote work. And if it can be done in a way that reduces costs and doesn't affect value or experience or quality or experience, like what's to stop us from doing it? And then the second piece is we live again in a world where healthcare is getting the crunch from payers, from regulators, from even patients and consumers because of the rising costs. And there's really a couple ways you can get around this, right? You can I mentioned this a few episodes ago, like you can go and lobby Congress or try to lobby the insurance companies and try to get a few more dollars on each visit or however it works, however you want to do it. But it's really just diminishing returns. You're fighting for scraps. And the reality is we can innovate our way out of this. And one of the ways we can innovate our way out of this is to radically decrease the cost of care or the cost of delivering that care. And sometimes that might mean outsourcing expensive work that can be done remotely and from anywhere to another region or another part of the world where it can still be done effectively and efficiently, but at much reduced rate. So, this might not be for everybody. I think it's just an interesting topic and discussion to have. And like Dr. Kupferman shares, he saw it for his dental practice as this being kind of the future of healthcare, to have remote work doing a lot of the administrative work that doesn't necessarily need to be done in the office and that can be done for much cheaper elsewhere. So hopefully this, if nothing else, this conversation gives you a little something to think about or an idea to take home to your practice. So without further ado, here's Dr. Kupferman from Medva talking about virtual medical assistants to streamline care. Well, hey, Dr. Kupferman, welcome to the show. How are you?
Good. How you doing?
I'm doing all right. I'm excited about talking about scaling a medical practice using virtual assistants and all the kind of the ins and outs of that space. But before we do that, why don't you just tell us a little bit about yourself, your professional background, and then kind of what got you into doing what you're doing now?
Sure. So I'm an oral and maxillofacial surgeon. I went to dental school and then medical school, did internship residency, and then first job was working for a large healthcare system, and I opened up a private practice of oral and maxillofacial surgery in 2009. And we currently have 6 surgeons there. And over time, I have pretty much managed, the practice almost exclusively throughout the entire time. And there was just a point in time several years ago where I was reading up on virtual assistants and started to realize that the biggest burden for me was not necessarily being a doctor, but it was really managing people in the practice and trying to keep it as efficient and as high quality as possible. And I realized that, I needed more people and didn't have the real estate for them and didn't have the patience to have them really in the office all the time. And this is all, of course, pre-pandemic, and just realized that this was kind of the future of private practice healthcare, to have people doing a lot of the administrative work remotely. And the Philippines being a country that has a real strong healthcare background, it was really the most obvious way to go.
Awesome. So now that takes us into what you're doing now, which is MedVA, which is medical virtual assistants. And then how do y'all work and what do y'all do? I mean, it's pretty self-explanatory in the name, right?
Well, yeah, I mean, it's pretty self-explanatory in the name, which is why we chose the name, of course. So, there's so many things that we can kind of unpack here, but, MedVA or Medva, which we like to call it, is a company that provides virtual staffing for healthcare institutions, healthcare practices, private practices, and they can serve a multitude of tasks and jobs within practices and within healthcare institutions. And the main thing or the main difference that we provide is that they're your employees. They're working for you on a day-to-day basis. They come when you want. They start when you want them to start. They're on when you want them on. They're off when you want them off. They're working specifically for you. It's not a center, a call center, or an institution that they're, maybe taking a call for one doctor 1 minute and then 5 minutes later it's another, doctor's office, like many of the older sort of on-call systems work. These people are working specifically for you. So you choose them and they work for you. They're just not in your office. They're working remotely. Everybody understands what remote work is now. So
Yeah.
it's pretty easy.
Yeah. So that is one of the big differentiators there, right? Like I don't know how many people have gotten involved in some kind of like get a virtual assistant, whatever, and it might not even be the same person, right? That they're getting that is handling like 3 or 4 different clients at a given time. So what is the process then that you use to kind of source these virtual assistants? And then I guess is there some kind of training that they undergo, or is that all kind of, since they work for the practice, is the practice under the responsibility of training these people and getting them up to speed and all that kind of stuff?
Yeah, so our company is sort of divided into a sort of recruiting and training and retaining arm, and then there's a customer service arm, which essentially is putting the doctors and healthcare institutions in touch with the virtual assistants that we've trained, recruited, vetted. And so that's kind of the two main arms. And so we spend a lot of time looking for very talented healthcare trained professionals, mostly in the Philippines, although we have several in South and Central America, because a lot of our clients want Spanish speaking virtual assistants. So we recruit them, we train them. A lot of them are already nurses or therapists or some doctors, and they're already, they already know the medical profession. And so we train them on things that are maybe more American healthcare. And then we have some specifics who are trained in, say, dentistry and other sort of healthcare fields. And then, we make them available to prospective client doctors, client healthcare institutions, and they have the opportunity to interview them and then hire them. And the speed by which that happens is incredible and incredibly more efficient compared to what we're dealing with here in the U.S. from the Great Resignation, and sort of handouts and things that are keeping people out of working in medical offices. So that's sort of how it works. And you as a client would, or as a client doctor would still have to train them on the specifics of your practice. How do you pronounce Kupferman? Is it Kupferman? Is it Kupferman? What do you do on a daily basis in your office? All the things that you would have to train anybody who's coming into your office to do. But they already know medicine. They already know dentistry. If it's somebody who's going to work in a dental office, they already know billing, collections. They already know what an EOB is. They already know all those sorts of things. It's just they need to know the institutional memory of your individual practice.
Yeah. So you're cutting back on some of that training time of getting somebody in that's, maybe new to the field or something like that. They've already got like a baseline level of training.
Yeah. Well, gosh, for so many years, the healthcare practices in the United States were managed by high school trained, very smart, intelligent people who ran doctors' offices for so many years, and that that group of people has sort of disappeared in many ways, right? It's very hard to find that kind of person who's willing to just sort of finish high school and say, I'm going to work in Dr. Johnson's office, and that's going to be my career. You know, for the most part, they're finding opportunities online. They're finding work with other, say maybe higher paying non-healthcare, maybe tech industries. And so it's become incredibly difficult for the average doctor to find those 3, 4, 5 people who have ran our healthcare system in the
Yeah.
private sector for decades. And so you're still, for the most part, going to need somebody sitting up front, but all the other work that needs to be done virtually can be done virtually.
Yeah. Yeah. Well, especially like you said, the verifying benefits, EOBs, all that kind of stuff, which kind of leads into the next question. So obviously you need somebody in the clinic for, answering the phones, greeting people when they walk in. What are the big, I guess, big ticket item tasks that a healthcare virtual assistant would do for a practice?
Yeah. So the easiest way to get started with a virtual assistant is benefits verification. That essentially had been the task of one of the people I described earlier, and they would be calling another person working for some insurance company or some benefits provider in the Midwest of the United States or somewhere else, and that call was pretty quick. You picked up the phone, you called, and somebody answered. Today, most of those sort of institutions are staffed virtually as well.
Yeah.
And so they're either in the Philippines or South America, and so it really is impossible to keep up with those economics. If you're paying somebody in your office to do that, then you're not going to be able to keep up with the cost cutting that the insurance companies are doing, or any payers are doing. So that's certainly the easiest way, because it's extremely time intensive. You're really just getting information. A lot of times that information is technically available in some sort of portal, but a lot of it is not accurate, as you may know. And so it does require person-to-person communication with sort of certifications and identification numbers that are going to be used when you're adjudicating a claim 2 months down the line. And so that has to be properly documented, and a simple portal isn't really going to do, as everybody really knows who's ever tried to adjudicate a claim in the sometime down the line. So that's really the best way to get started with a virtual assistant. For $10 an hour, you can have somebody who's doing that 40 hours a week. And any reasonable size practice is going to need somebody to do that on a day-to-day basis, every hour, every minute. It's really easy to do, and certainly the easiest way to get involved in using a virtual assistant. And then it just goes from there. Then you start getting somebody to do billing and collections and phone calls and follow-ups and reviewing EOBs and all that. You just follow your revenue cycle entirely. You can just add a virtual assistant at every step of the way.
Yeah. Now, so you mentioned something during the benefits part, which we're going to circle back to here. So obviously these people are getting account numbers, social security numbers, I would assume, or, policy IDs, all of that kind of stuff. What kind of security risks would be involved in having a virtual assistant do that task? Or are there ways that it's already kind of mitigated with encrypted communications and all that kind of stuff?
So yeah, look, there's risk with any employee. As a business owner, have those sort of risks and liabilities, and they are generally mitigated by insurance policies and good training and trust, communication, etc. In the U.S., we have laws, for that as well. They're not nearly as strict as the laws, or at least the punishments are not nearly as strict as they are in the Philippines. So if you have sort of HIPAA violations or credit card fraud or whatnot in the U.S., oftentimes it's either a fine, and if you can't afford it, then sort of off the hook. In the Philippines, you'll be doing a lot of jail time if you're lucky. If you're not, there's much more strict punishments. So in the Philippines they have a very very strict policies, because they live. This is their industry. They live and die by this, as a country. And if they lose the reputation of having good security, honesty, then this industry will fall apart, and it makes up for a tremendous part of their GDP. So they're not messing around, nor are the authorities going to mess around with somebody who is messing around.
Yeah.
So now on top of that, of course, we train and vet and certify every virtual assistant with both HIPAA and other sort of security policies. But anything can happen at any time. We've seen among the countless hours that our virtual assistants have put in, incredibly tight security. And so we have additional policies that we can offer to clients who are really concerned and want to mitigate
some of that risk,
all those risks. So and that's how it is. Every personality is different, right? Every single there are going to be people in this country that are doctors that are going to say, I will never use a virtual assistant, because they just don't feel comfortable not having
being able to see them.
Not being able to look over their shoulder until they don't practice anymore. And there are people who are going to, it's the same with malpractice liability, right? I mean, there are doctors who practice in certain ways, and there are others that practice in other ways because they're just so scared about a malpractice, lawsuit. But the numbers, don't necessarily support that. So, there's some risk for everything, but you have to get comfortable with with the idea, because it's the future. Everybody's doing it, and all of our vendors are doing the same. Every single insurance company is using an outsourcing of some sort. So we're just gonna have to do it to keep up.
Yeah. Well, then talk to me a little bit about, maybe you can even use your own practice as an example about how one would scale a medical practice or a dental practice or something like that using, the power of technology and virtual assistants and all of that. What could that look like?
Yeah. So, this is really the key, because you really do need to, to think out of the box in order to do this, because there's no training for this. Nobody's ever, no one learned this in medical school, dental school, physical therapy school, chiropractic school. You don't learn any of this. So you have to sort of be somewhat forward thinking. But to me, the real trick is to start with one person. And what's great about virtual employees versus call onshore or in office employees is that they're so tech savvy. So if you sort of spend an hour or 2 hours with your first virtual assistant, giving them the institutional memory, and you record that Zoom session, it'll be available for every single one thereafter. And if you use that and leverage that simple technological power, the scaling becomes so easy. So every time you teach your virtual assistant something, they'll record it, they'll save it, they'll archive it, and they'll have it forever, so that the next person can spend their first 2 or 3 or 4 days learning that, and so forth and so on. And you can do that. And every time you have a new task, that task gets, recorded. And then that translates to, the next virtual assistant, and so forth. And so for me, I did that with my first virtual assistant. For some reason, I had that foresight to tell that, my first virtual assistant, hey, well, let's keep this like recorded. Like, I'm going to tell you how I built this practice, where it started, who it came from, who came from here, and then next, and so forth and so on. And you get that institutional memory and, recorded to the point where it can be used, for your scale. And so we would purchase courses in the beginning, oral surgery specific courses, and record them, and then pass that on. And then this way, then when just like any new employee, when you're a private practice doctor, you don't have time to train your employees. There's absolutely nobody does that. It's just not possible. So here, after a few months, you're going to have a week's worth of recorded information on what this person needs to know about how this practice works and what the tasks that are being done in the practice. And so your first week, that first virtual assistant is going to be watching, 10, 12, 20 hours worth of recorded Zoom sessions. And that's really how you can do it. When you have people in the office, that stuff's never recorded. You just sit there and tell one person, and then they are supposed to play telephone and pass it on to the next person. So to me, that's the way to scale, is to use technology to scale. And we all have that technology. They don't even have to buy it, right? It's all free for the most part, and we all have, 20 terabytes of data from Google or Amazon or whoever you're using to store all this information. So that's really the best way to scale. And then you start, depending upon the size of your practice, you start thinking of all these things that are being done. Transcription, we talked already about billing and revenue cycle and benefits verification, transcription, review of records, putting together some, reports, documentation, scribing, all of that can be done virtually. And then for bigger operations, bookkeeping and record keeping and, bill paying and accounting, and marketing. These are all things that don't require somebody to be sitting in your office. And these are things that every single office does.
Yeah. Yeah. I guess one of the other questions I would have too, like, the show obviously is about better outcomes or improving healthcare for everybody, for not only the business owners, the practice owners and the clinicians, but also the patients or the clients that are coming into these organizations. So how can a virtual assistant improve the patient care experience at a given clinic? Like, is it just an efficiency play? Like, they get their information more efficiently, or are there other benefits to using virtual staff that can improve patient engagement, experience, all of that kind of stuff?
Yeah. So, it depends on what your outcome what outcome measures really you're looking for in a practice. I would say that, the medical education in our country does a very good job at teaching you to be a great doctor. And so, but I think the hardest part is, in private practice, which is why private practice is probably dwindling in many ways, is because it's really hard to manage a practice.
Yeah.
And I think the biggest factor is time, and manpower. And I think if you asked any doctor, what the biggest commodity is, it's their time, and we as doctors, we can't afford, based on our reimbursement, to hire enough people to do all the work that's needed. And I think sort of by definition, that's why virtual assisting is so imperative for doctors to take on. Because if your biggest commodity is time and you can't afford to hire more and more people, and that's becoming even harder to do, obviously, then you need to find a way to mitigate that. And virtual assistants are the way to mitigate that. There's really, the $10 an hour person or $15 an hour person to work in your office is gone. Yeah, it's 25, 30. I think when I first started, dental assistants, and this is, let's say, 13 years ago, a dental assistant or an MA was making $13 an hour, 10 to 13. I don't
Yeah.
think you can find somebody for under 30 now who has some experience,
Yeah. Well, part of that is because they keep going to school and getting more and more higher level certifications and training, right?
Well, yes and no. I mean, even those that don't, they can't live on those kind of
Yeah,
salaries
that's
anymore,
true.
and with I just got a bill from my pool man, not a bill, a letter just saying like we can't pay for the gas anymore to come at the rate that we had a few years ago or a few months ago. And so they just sound like, hey, this is the new fee, and it went up, I don't know, 30%, 20%. And that's the reality. I think every single item is going to go up 20%. And payroll is the biggest expense in a doctor's office. There's no doubt about that. So that's going up 20%.
Yeah,
So,
exactly.
and that would be a good day if it's going up 20%, or a good year. So, I just don't see, I mean, I think it's more efficient, answering your question. I think it's extremely more efficient. There's less clutter, there's less paper, there's less people around. Um, and I think the outcomes, are fantastic. There's good data for this as well. And I think it's just a necessity, for the outcomes to actually, occur. It's a necessity.
Yeah. All right. Well, we're getting near the bottom of the hour here. So I always end the show with this question. So if there's one or two main takeaways you would want a listener to walk away with from the episode about virtual assistants and how they can help with practice, what would they be?
Well, I mean, I think the main takeaway would be, if you are not using any virtual assistants right now, I think you need to take a look at that. And if you're running a private practice, and you're not using some virtual healthcare assistant, I think it's something that you just need to take a look at. You got to take a real good deep dive and look into that.
Awesome. All right. Well, Dr. Kupferman, where can people find out more about you, about Medva, about all of the places where people can find you?
Sure. So yeah, our website is www.medva.com, and you can find out anything there. And if you want to find out more about me, you can Google me, and you'll find my practice in Century City. But that's you know just a regular oral surgery practice. If you want to know about Medva, it's pretty easy. Just go online. We've got plenty of videos and doctor testimonials about how effective and efficient and the outcomes that they've seen from using virtual assistants.
Awesome. Cool deal. Well, Dr. Kupferman, thanks so much.
Thanks so much, Rafi. It was great meeting you.
Well, I hope you enjoyed that conversation with Dr. Kupferman about medical or virtual medical assistants and how we can use them, especially in private practice, to streamline care and decrease the cost of delivering service. So, again, I just think it's such an interesting area to explore, because for a long time, unless and this is one of the reasons why I'm still super optimistic about the world. You hear a lot of times from, especially in the therapy world, where I spend a lot of my time because I'm an occupational therapist. I own an OT and PT clinic. I work with a lot of PT practice owners. There's just a lot of negativity out there in the world at large about, it might be what the economy is doing, or the payers are putting the crunch on us, whatever it tends to be. And there's just this kind of this negativity, or pessimism is probably the word I'm looking for. Pessimism about the future and what it might hold for our profession and all of that. Things like this kind of validate, at least to me, they validate that this is one of the best times in the history of the world to be alive, and to be in business, and to be in a position to deliver care, to run a practice, or to make your calling your enterprise, to quote Blair Enns from Win Without Pitching, because technology has really removed the geographic barriers to doing work in other parts of the world because of technology and the ability to do remote work. It really gives us access us here, particularly in the United States, us access to an entire workforce of people who are willing to work, who are going to do very good work at a reduced cost. And it is not to say that we're taking advantage of these people, because again, we're paying them and they are being paid more here, and especially because of the exchange rate. I was on the phone with one of the, full disclosure, we're moving forward with using Medva at our practice Proactive. So I was talking with their client relationship manager, and I said, man, what's the turnover? Because it seems like you're going to be having a lot of turnover with a job like this. And she said, well, actually, because of the exchange rate between the dollar in the US and the Philippines, that they're actually getting paid significantly more than they could go out and make in their own country, in their own time zone even. So the retention rate is very high. And all that is to really say is that it is a win-win for both the practice and even the local economy of the people who are doing the work, right? Because they now have more money in their pocket than they would otherwise have, which can feed the economy. But then also the practice owner here is getting the benefit of high quality work at a fraction of what they could pay or would be paying for that work to be done here in the States or in-house even. I mean, you consider doing something like an office space, a computer, all of that kind of stuff, the equipment, the overhead expense, that goes away with remote work, which is why many people have moved to remote work. I was talking to a friend of mine who owns a marketing firm, and he's like, oh yeah, we go to the office every now and then, but ever since COVID happened, we have the office there in case we want to meet clients or in case we need a space to do some production. Otherwise, everybody's remote now. And the reason they do that is because it costs less money and sometimes it's more efficient. So the idea of being able to take those principles of kind of reduced costs, increased efficiency, improving the streamlined process of care, and applying them to a smaller private practice, which 10 years ago, that one would have been unheard of, and two, it probably would have been very cost prohibitive if you had done it. Now it's something that we can do and we can all tap into. So not saying that everybody should go out and do this or everybody should go out and try it. It's another example to me of how just the growth and the expansion of technology into our regular lives and business worlds is making it cheaper, easier, and better to be in business now and to run practices and to deliver services to clients and patients than it ever has been in the history of the world. So yes, I'm not saying that there's not problems with insurance companies trying to take advantage or cutting the cost and reducing benefits to their plan participants and all of that. Like that, yeah, that's all real and that's happening and we can deal with it. But it shouldn't overshadow the fact that as clinicians, as people with skilled knowledge and expertise, this is the best time in the history of the world to be involved in serving clients with that knowledge and expertise, whether it be through clinical private practice or whether it be through some other form of monetizing your skills and your abilities through entrepreneurship, some kind of digital entrepreneurship. It's just a really exciting time to be, one, to be alive, but also to be in healthcare and to see the way that technology is being used to improve the process of care, sometimes even to make healthcare more human, which is what we're all about here at Rehab U, right? And the Better Outcomes Show. And to deliver care more efficiently and hopefully at a higher quality. So anyways, that's all I've got to think about that, to say about that topic. I do think despite all of the negativity in the world, we just have a lot to be hopeful about and optimistic about moving forward. Anyways, if you like the show, head on over to iTunes, leave us a rating and review. It helps people find the show. If you want to be notified when we drop new episodes, you can go to www.betteroutcomes.show or rehabupracticesolutions.com. Click the Insights tab and then podcast and sign up there. We'll send you an email with the show notes and with links to the guests and all of their information. at that time, or when we send out the email. We typically drop episodes every other week. However, I will say that I have just recorded a few bonus episodes, so probably from now through the end of 2022, we'll be dropping an episode once a week at least, because of the influx of interviews that I've done and cool interviews that we've got in the works. So look forward to that. And if you are in the time of the year right now where your clinic schedule is kind of lightening up a little bit, excuse me, and you're trying to reduce the cancellations and the no-shows at your clinic, and you want to know how to do that for free using a proven framework, you can head on over to rehabilipracticesolutions.com/cancellations, and you can download our cancellation reduction framework. This is the framework that is based off the work and the complete framework available in the book, The Better Outcomes, A Guide to Humanizing Healthcare book, which is again available via Amazon. But it's a framework that we've implemented with clients, with the clinic that I run, as a way to increase engagement and get patient buy-in before they even show up to that first appointment, so that you know you have a higher likelihood of an arrival rate and a plan of care completion. So again, the URL for that is rehabilipracticesolutions.com/cancellations, and you can download your free copy of the cancellation reduction framework there. And if you run an outpatient physical or occupational therapy clinic or some kind of allied health clinic, and you want to implement a system like that in your clinic and you don't have to build it from the ground up, reach out to me at info@rehabilipracticesolutions.com, or go to rehabilipracticesolutions.com and schedule a time on my calendar, and we can have a chat about what you've got going on and if it makes sense for us to do some work together. Until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabilipracticesolutions.com. We'll catch you on the next episode.